Hi, welcome to Nursing Notes Corner. So, next topic is New Year modalities of pregnancy. Okay, so what are the New Year modalities of pregnancy? Let's see. Okay, so New Year modalities of pregnancy is classified into two types. Okay, one is invasive procedure, and another one is non-invasive procedure. Okay, so in invasive means it is a painful procedure. Okay, so here it is a painless procedure. Okay, and for example here chorionic villus sampling. Okay, chorionic villus sampling amniocentesis MSAFP, which means maternal serum alpha fetoprotein. Okay, so here cardiotopography, USG, non-stress test, contraction stress test, amniotic fluid index. Okay, so invasive and non-invasive. Okay, so next one is what are the indication. Okay, so indications, let's see. So in indication, it is used to index the growth and development of fetus. Okay, to find the growth and development of fetus. Okay, so next one is it is used to reduce the mortality and morbidity rate. Okay, mortality and morbidity rate. So next, to avoid abortion. Okay, to avoid abortion, and to prepare the mother for labor. To prepare mother for labor. Okay, so these are the indications. So next one is we are going to see USG. USG means ultrasonography. Okay, so USG can be done through abdominal and transvaginal. Okay, so let's see the difference. So first one is abdominal and here transvaginal. So let's see the difference between abdominal and transvaginal. Okay, so here bladder has to be filled. Okay, in abdominal USG, bladder has to be filled with fluids. Okay, filled with fluids, and here empty, so bladder should be emptied. Okay, so next point is gel should be applied in the abdomen. Okay, and here, so in abdomen, and USG transducer should be applied over the gel. Okay, on the abdomen, so it will, so that it will give a clear image. Okay, so here a small transducer. Okay, here inserted into the vagina. Okay, so this is about USG. So next we are going to see cardiotopography. Okay, so let's see. So it should be done in third trimester. Okay, cardiotopography should be done in third trimester. So CTG. Okay, it is used to detect fetal heart rate. Okay, CTG is used to detect the fetal heart rate and uterine contraction. Okay, so normal heartbeat is, normal heart rate is, so 110 to 160 beats per minute. Okay, so here there is a deceleration and acceleration. Okay, so next, what are the advantages of CTG? Okay, so it detects the hypoxia. Okay, it detects hypoxia and also fetal death, and so it is a medico legal procedure. Okay, these are the advantages of CTG. Next, disadvantage. Okay, so what are the disadvantage means? So it is expensive and mother has to be in bed. Okay, mother has to be in bed. Due to machine problem, false production due to machine there may be a false production. Okay, sometimes false production may happen. Okay, so due to false production, patient may undergo LSCS. Okay, so next one is non stress test. Okay, it should be done above 30 weeks. Okay, so okay, it is a simple and painless procedure. Okay, so here baby heart rate is continuously monitored. Okay, monitor for 20 minutes or more. Okay, along with fetal movement, so let's see what are the indications. Okay, indication to non-stress test: if the mother having DM, hypertension, and if baby is less active, and oligohydramnios or polyhydramnios. Okay, or polyhydramnios. Okay, let's see what are the nurses role. Okay, nursing role. So here the patient should be placed in supine position. Okay, supine position. If the patient is having BP, low BP, which is hypotension, the patient should be positioned in recumbent position. Okay, and ask the mother to take a deep breath. Okay, so check the fetal position. Okay, next, check fetal heart rate. Okay, heart rate. If the fetus is active, if the fetus is reactive, the heart rate is above 150 bpm beats per minute. Okay, if the fetus is non-reactive, the heart rate is below 110 beats per minute. Okay, so next procedure is contraction stress test. Okay, so first here check the vital signs. Okay, check the vitals. So here assessment should be done before 20 to 30 minutes. Okay, so oxytocin 30 international unit plus 500 ml of oral NS. Okay, so 1 minute. So next one is nipple stimulation test. In nipple stimulation test, it is done for 2 minutes. Okay, so nursing role is see whether the patient has any bleeding and note down the procedure. Okay, so next one is amniotic fluid index. So here it is a standardized way. Okay, it is a standardized way to assess the sufficiency of amniotic fluid. Okay, amniotic fluid during pregnancy. So it is a standardized way to assess the sufficiency of amniotic fluid quantity during the pregnancy. Okay, so what are the purpose? So it is to identify oligohydramnios and polyhydramnios. Okay, and polyhydramnios. So oligohydramnios means low amniotic fluid index, and falling means increased. Okay, so so if the amniotic fluid is above 4 centimeter, it is said to be polyhydramnios. Okay, if it is low, it is oligohydramnios. Okay, so these all about non-invasive procedure. So next we are going to see invasive procedure. Okay, so here now in invasive procedure, first one is chorionic villi sampling. Okay, so here it is done in transcervical and transabdomen. Okay, so it is done in first trimester. So next one is amniocentesis. So next one is amniocentesis. It is done in second trimester, which is 20 weeks. Okay, so it is a medical procedure. Okay, so it is used for prenatal diagnosis of chromosomal abnormalities. Okay, so next one is fetoscopy. So here fine caliber endoscopy is inserted, okay, into the vagina to visualize the embryo. Okay, to visualize embryo for tissue sampling. So this is about fetoscopy. So I'm giving only a simple notes. So next one is MSAFT, which means maternal serum alpha fetoprotein. Okay, P. So the developing fetus, okay, developing fetus has two major protein. Developing fetus will have two major protein. Major blood protein. Okay, so one is albumin and alpha fetoprotein. Okay, so adults only have albumin. Okay, so here the developing fetus will have two major blood protein. One is albumin and another one is alpha fetoprotein. Okay, so in adults typically it have only albumin, okay, in their blood. So the MF test can be maternal serum alpha fetoprotein test can be utilized to determine the level of alpha fetoprotein. Okay, level of alpha fetoprotein from the fetus. Okay, so this test is done. Okay, if the alpha fetoprotein they have this proportion, it leads to neural tubule defect. Okay, neural tube defect. These all about newer modalities of pregnancy. So if you want more content, you can refer books. Okay, thank you.